Hi, I wish I could be with you today. I'm so glad that you're all together talking about social work and politics and how to be involved in elections, how to make change happen. That's really what I'm all about, what I have been doing now for years. And I can tell you that having my MSW from Michigan State has been invaluable to me. I want to thank Dr. Shannon Lane for your leadership at the wonderful Humphreys Institute, and basically start by saying to each of you that if you're interested in social work, if you want to be a social worker, government, politics is going to affect you whether you're paying attention or not. It affects all of us as citizens, and the most powerful public role that we have in America is as a citizen to speak up, to vote, to participate. But as social workers, we will be affected, you are affected every day by decisions that policymakers like myself make. Will we fund community mental health? Will we fund health care? Will we focus on children? Will we provide food assistance for people or affordable housing? Will we provide reimbursement for MSWs? What will licensure look like? What will reimbursements look like under insurance? Will we have mental health parity? Everything from regulations to the things that you care about, to whether or not you'll be able to serve people, or whether or not you'll even be able to have a job. If you are in social work, you need to be paying attention to the people that are making decisions in government, in public boards and commissions, and you need to be involved in a very direct way. You know, I was getting my master's at Michigan State when I first got involved in politics, and I cared deeply about issues and never really saw the connection. I was at a meeting with a group of women where some folks trying to save the Ingham County Medical Care Facility, the only facility at the time, the only nursing home that at the time took Medicaid in the community in Ingham County. And they came in to tell us that the County Board of Commissioners was thinking of closing the entire nursing home. So I grew up in healthcare. My mom was a nurse for 42 years in Clare, where I grew up. I deeply care about healthcare. And so I got involved. One thing led to another. I ended up leading the effort that saved the nursing home. But I started going to the county commission meetings and listening and watching and learning about who they were and how they were making decisions. And then I afterwards got involved when we saved the nursing home. People came to me and said, "You should run." And so I was mad enough at the time, and I lived in the district of the person leading the effort trying to close the nursing home, and so I decided I was going to run against them. And so I was 24 years old and knocked on every door several times and told this story of what I thought the county should be doing in terms of services. And one thing led to another. He called me that young broad running against him, and the good news was the young broad beat him. So I went into county government that funds the jail and delinquency programs and community mental health and public health and clean water programs, as well as roads and everything else that directly affects our lives. And I learned so much about how to provide services and how to work together to get things done. And I have to tell you, as I've moved from state government now to being your senior senator in the United States Senate, that at every step of the way, it's been the same principles. No matter how strongly I feel about something, I need to be able to listen and reach across the aisle. We've got to figure out a way to find some common ground if we're going to get something done. You know, win-win is the way to do it, not smashing somebody's face in or putting somebody in a situation where they're going to lose in order for you to win. That normally doesn't work very well, and I've been successful over the years by finding ways to work with people. Even if I only work with someone on one issue, and 99% of the time we're voting in opposite directions. I'll give you an example of that. I am leading the effort on community mental health and addiction services to get real community mental health centers, quality centers in the community, fully funded, and addiction services fully funded. And my partner is Senator Roy Blunt from Missouri, and Roy and I don't vote the same most of the time, but he and I have worked together on health centers, are passionate about community services, and have come together to become friends and partners in an effort that I hope later this spring is going to really benefit Michigan directly in terms of moving people from jails that should be in community outpatient services and providing the kinds of support that individuals and families need. But Roy and I don't vote the same on most things, and that's okay. We just need to come together around one thing, and that's how I get things done. Look for the one thing that you can connect with someone on. Try to listen and be in their shoes, no matter how difficult it is to imagine how they are thinking. Social work allows you to listen, active listening, and be able to look for commonality somewhere with another human being. And that is really important in governing, in politics, and I think also in life. So I'm glad you're here today, and I hope that you will consider running for office, work on somebody's campaign, be involved in advocacy. We need all of that. If you feel that you have the passion, you should step up and run yourself. Don't wait for somebody to ask you. Believe in yourself. The information, skills, and experiences you have right now are enough to have you be effective in order to be able to serve the community or our state or our country in some way. What we need right now are people with ethics and morals and compassion and competence and a great work ethic that are willing to actually reach out and bring people in to be able to find solutions to some pretty big problems that we have. And I'm counting on you guys to be doing that and to be joining me in the effort, particularly this year, to be able to see the right kind of change happen. You know, the novelist Alice Walker wrote, "The most common way people give up their power is by thinking they don't have any." You have power right now, where you are, even before you go through a workshop and learn a lot of new wonderful things about campaigning and about politics and about organizing. You have power right now. So believe in yourself, believe in your own power, and focus on the kind of change that you want to see in the community, for yourself, for your family. That's how we do it. And social workers can lead the way. Have a great conference.